So the enterprise master patient index, I will not come back to it. So basically, it's not, of course, mandatory in the architecture. In some countries, for instance, in the Nordics, they rarely use master patient index for a simple reason. They already have a unique patient identifier at the country level, okay? But even in some cases, when you have a unique patient identifier, it's not completely stupid to go work with the master patient index, for instance, to deal with foreign people, or in some particular cases when it's pretty hard to identify clearly a patient. So anyway, it's a component of the architecture. One key point is that this enterprise master patient index, which is what we face most of the time, can also be connected to other enterprise master patient index. What we see in Western Europe is that most of the time these initiatives are regional. So it means that in a country like France, for instance, you will probably have something like 15 to 20 different enterprise master patient index. And the day you want to create one single electronic health record at the nation level, you definitely need the technical capabilities to connect the MPIs between each other. So of course all the viewers, but this is clearly not the most important, we provide a comprehensive set of tools. First of all, this one is really to access the registry and the index and to access any kind of document, okay? And depending on the type of document you want to upload, clearly you have a set of viewers to access these data. In this particular example, of course, we retrieve diagnostic quality images. Everything is DICOM, okay? So I mentioned it previously. As you can see, we're using some streaming technology that allows to use low bandwidth to do this. So, without going into detail, I have here 2 slides just to show you that basically it's really not complicated. It's complicated for us, but as soon as it's done, I mean, it's pretty easy to set up. So the way it works, and I'm sure you're familiar with it, in this example, it's for image exchange with a radiology information system and a picture archiving and communication system, but basically it's true for an electronic medical record. So if a master patient index is involved, first of all, the local IT solution is going to feed the master patient index using PICS identity feed, so providing the local ID. So this local ID is going to be registered inside the registry. So, sorry, the global ID is going to be registered within the XDS registry, and the role of the patient, the master patient index, is clearly to create the link between the local ID sent by the local RIS and the global ID, the regional ID that is created and taken care of by the master patient index. Then, of course, each time you need something and to work on a new patient, the RIS is allowed to query for this global ID to make sure that everybody is working on the good patient. Now, when I create from the radiology information system a new document, a report, I push it through an XDS transaction towards the XDS repository. The XDS repository is in charge of indexing it. Sorry. Ah, okay. I thought I had 5 more minutes. I'm gonna push. Okay. Do you give me 5 more? 5 more? 2 more. Okay.
2 minutes.
Okay, 2 minutes. Okay. So just to show you that yeah, it's pretty easy to work with. Okay. I go quickly. I just wanted to show you 2 examples. This one out of 5, but this one, that's where we learned that basically when we do these kinds of projects, we can easily save between 3 to 5% of unnecessarily duplicate examination. We have the proof that we can do that here. Another one I would like to mention is a recent big project that we are currently implementing in the Paris area, because it's going to be probably the largest ASP RIS PACS project that we ever implemented worldwide. So basically the whole area of Paris becomes completely filmless. We provide the clinical tool, the archiving system, and all image exchange solution around it. So as I was saying, and I will finish with that, the purpose initially when we built this infrastructure consisting in being able to connect any kind of actor and any kind of information. So basically we leveraged it and we plugged additional connections and additional tools around clinical exchange. So we are now able to basically create a comprehensive electronic health record, okay, such as here, this is the French model, connecting all hospitals, millions of citizens, all GP system, all clinician, all laboratory, all pathology, all pharmacy, and taking care of the issues of privacy, authentication, and encryption. Okay, so for the healthcare actors now, the same solution as the one I presented for imaging has evolved towards a comprehensive electronic health record. We of course have the same vision for the patient. Okay, the patient can access to all information, and in this particular example, he also uses some tools to deal with the patient consent for him or for his children, for instance. And this personal health record, and I will finish on that, basically allows us to plug additional functionalities such as care and disease management involving most of the time home care. And we've got an example, for instance, through this project, which is Partnership for the Heart, in which basically we connect, we set up a kind of bundle for each patient at home. It's around heart chronic disease, and basically we connect any kind of medical devices at home, and the patient is monitored at home, and the whole solution is connected to the electronic health record and to the local electronic medical record, and also to the ambulance solution to monitor the patient. Okay, I propose to stop here. Thank you, sorry for being late.